Allergies and sickness can often have overlapping symptoms, but they are fundamentally different conditions. Allergies are your immune system's hypersensitive reactions to certain environmental substances, known as allergens, such as pollen, dust, or pet dander, which can lead to symptoms like sneezing, itchiness, a runny nose, and watery eyes. When you're sick, on the other hand, it usually involves an infection caused by bacteria, viruses, or other pathogens and can lead to fever, body aches, fatigue, and a variety of other symptoms depending on the illness. Treatments for allergies often involve antihistamines, decongestants, and allergy shots, while treatments for sickness may include antibiotics for bacterial infections or antiviral drugs for viral infections, alongside rest and fluids. Risk factors for allergies can include a family history of allergies, while being sick is often related to exposure to infectious agents and a weakened immune system. Here's a detailed look at the distinct aspects of each condition. Symptom onset, sudden versus gradual. Distinguishing between allergies and sickness often hinges on the suddenness or gradual nature of symptom onset. Allergies typically manifest quickly after exposure to an allergen, think minutes to a few hours, unleashing immediate reactions such as sneezing, itching, or hives. In contrast, sickness, like a cold or flu, can sneak up more subtly, with symptoms like fatigue, fever, and body aches emerging and intensifying over a few days. Notably, allergies can recur with consistent exposure to the trigger and usually don't present with fever, while sickness runs a self-limited course and often includes a high temperature as the body fights off an infection. Seasonal variation, periodic versus constant. Seasonal allergies typically occur at specific times of the year in response to environmental allergens like pollen, molds, or grasses, and are characterized by symptoms such as sneezing, itchiness, and runny nose, which frequently subside with either the change of season or avoidance of the allergen. Conversely, symptoms caused by a sickness, such as a cold or flu, can arise at any time and often present progressively, accompanied by a wider array of systemic signs including fever, body aches, and fatigue. Distinguishing between these two conditions hinges on the pattern of manifestation and the constellation of symptoms. Allergies recur with environmental exposure and usually absence of fever, while infections are more sporadic and systemic. This understanding is essential for appropriate management, be it with antihistamines for allergies or antivirals and rest for illnesses. Primary triggers, environmental versus pathogenic. Allergic reactions and infections both elicit immune responses, yet they stem from vastly different triggers, environmental for allergies and pathogenic for sickness. Allergies are caused by an oversensitive immune system reacting to harmless substances such as pollen, dust mites, or pet dander. Symptoms like sneezing, itching, and congestion are common, but they aren't indicative of an infection. Conversely, pathogenic causes such as bacteria, viruses, or fungi lead to illnesses like the flu or strep throat, where the immune system combats genuinely harmful invaders. Fever, body aches, and localized pain are more characteristic of infections than allergies. Understanding these triggers is crucial for proper diagnosis and treatment, as the approaches for managing allergies, antihistamines, and avoidance of allergens differ significantly from those for infections, which may include antibiotics or antiviral medications. Response to treatment, antihistamines versus antibiotics. When distinguishing between allergies and infections, the response to treatment offers critical insight. Antihistamines are effective in mitigating allergy symptoms, including sneezing, itching, and nasal congestion, by blocking histamine, a substance released during an allergic response. Conversely, infections caused by bacteria are treated with antibiotics, which target and kill or inhibit the growth of the responsible bacteria. Significant changes in symptoms following antibiotic treatment can suggest a bacterial infection over allergies. However, allergies will not respond to antibiotics, reaffirming their distinct etiology. This differential response can thus guide healthcare professionals in accurate diagnosis and appropriate management of the presenting symptoms. Associated symptoms, itching, sneezing versus fever, body aches. When distinguishing between allergies and sickness, such as a common cold or the flu, associated symptoms hold the key. Allergies typically trigger histamine release, which can lead to itching and sneezing, immediate defenses against perceived allergens like pollen or dander. Conversely, fever and body aches suggest systemic involvement, where the body ramps up its temperature to fight off an infection. Allergies are the body's false alarms to harmless substances, mistakenly tagged as threats, whereas actual sickness embodies the body's response to pathogenic invasions, rallying its immune arsenal to combat viral or bacterial culprits. These symptom patterns, therefore, can guide individuals and healthcare providers toward an accurate diagnosis, informing whether antihistamines or analgesics and rest might be the appropriate course.